My name's Pierre Côté. I've been practicing medicine in Montreal since 1988 at La Clinique du Quartier Latin, essentially treating people living with HIV.
Bonjour, je m'appelle Louis Saint-Amand.
Hello, my name is Louis Saint-Amand and I live in Montreal. I've had HIV for 16 years now and I'm 66. I have no intention of dying, so I hope you'll listen to a bit of this and let it motivate you to fight and figure out how to live a good, happy life, even with this nasty disease.
Même avec cette cochonnerie-là.
Quand on parle des personnes plus âgées dans le VIH, en médecine, c'est souvent le cas, la barrière est de 50
When we talk about older people living with HIV, we're referring to those that are 50 years old and up. It doesn't seem that it's that high, but that's the reference. We have two kinds of patients, those who've been in treatment for several years already. They're very experienced and used to taking meds. And there are also the people who are infected at a much older age. Younger patients have stronger immune systems and have more of a reserve. But as people get older, this diminishes over time.
Qui est importante, et cette réserve immunitaire-là diminue avec l'âge. Donc, il est certain que de débuter...
So it's quite certain that starting treatment with someone who is 60 years old, rebuilding the immune system will not be as effective. Often we're going to have to use more aggressive treatment to treat older patients than someone who is only 20 years old, for example.
At a certain point, it didn't seem to have anything to do with HIV. Just old age, a chaotic lifestyle, a lack of exercise. And I was also suffering from severe pain in my elbows. And then finally, one day, I thought, maybe it's time to see a cardiologist. So the doctor makes me sit there in the waiting room for half an hour. You see, I'm not a very patient person, so I got up and said to the receptionist, "You've got to tell him to give my results to the other doctor's secretary." And she said, "No, he wants to see you. He wants to see you." As a matter of fact, he found a bed for me at the hospital the very same day. It hit me hard, and I really got the blues. So I said, "That's absolutely out of the question. There's no way I'm going to the hospital this afternoon. You can't do anything for my heart. I'm going to die of anxiety." So, 2 weeks later, I checked into the hospital thinking they were going to put in an aortic pump to unblock my arteries. I stupidly signed all of the papers, and the next day, there I was in surgery, having a coronary bypass operation. They kept me in the hospital for the next 30 days, and now I'm here to tell you that I came out of it alive.
Un des problèmes aussi en vieillissant, c'est que les gens...
One of the problems with growing old is that people could have other health problems, heart trouble, higher risk of cancer, neurological problems, osteoporosis, and a higher chance of hormonal problems.
D'avoir des troubles au niveau hormonal.
In fact, I would say that when someone is infected with HIV, the body ages more rapidly. HIV spreads throughout the entire body, and this is why, in the end, there is a higher risk of heart attacks and strokes.
Un état d'inflammation dans tout l'organisme, et ce que l'on voit à la fin, c'est de plus grandes chances de faire un infarctus. On essaie de démontrer que les risques de faire toutes ces
We try to explain the risks and all that these complications can get even worse if you wait too long to treat the problem, since it attacks and weakens the immune system.
D'immunodéficience qui est plus important. Donc, de traiter plus tôt serait...
The earlier the treatment, the more beneficial it is. You have to take into account there could be side effects and adverse reactions to the treatment.
Des effets secondaires, puis il y a des toxicités aussi au traitement. On sait aussi qu'il y a des facteurs qui sont modifiés.
We also know there are other factors that are quite easy to deal with and change. It's well known that many HIV-positive people are heavy smokers and tend to smoke more than the average person.
Les personnes séropositives fument plus que...
This is one factor that can be changed. In fact, it's a significant risk factor in a variety of health problems.
Problèmes de santé.
Nutrition is also very important, so is physical exercise. They've both proven to be beneficial in terms of lowering overall health risks.
Le fait de maintenir un poids santé.
Maintaining a healthy weight, staying in good shape and good health, in fact, the best possible physical fitness, these are very important for quality of life.
Pour la qualité de vie, d'une part, c'est extrêmement intéressant.
One phenomenon that we have seen physiologically is a decrease in testosterone in men, that is, the male hormone. There are many cases where HIV can lead to reduced levels of testosterone in the blood. We often see symptoms in patients like fatigue, weight loss, depression, lower libido, and other problems.
On peut voir chez une certaine personne des symptômes de fatigue, de perte de poids, de dépression, une diminution de la libido, des troubles.
I'm going to tell you that despite your exasperation and frustration, which is perfectly normal, just tell yourself one thing. You're lucky. You're really lucky. Because you just happened to get sick at a good time, when there is really good medical treatment out there and you can get proper care. People don't die anymore of this, but you can die of social pressure. Sure, if you're already worrying about how you're going to feel in 3 months, or in 6 years, or how your grandmother is going to react when she finds out, that's just too much. Take it one step at a time, one day at a time. Breathe. If you have a good doctor, listen to what your doctor says. If you don't have a good doctor, try to get a new one. And take your meds seriously. It doesn't have to be dramatic, but you must take it seriously.
Plus la maladie avance et plus les gens vieillissent et on sont à risque de développer des problèmes de santé, c'est l'ostéoporose, qui est une diminution de la densité au niveau des os. Ça n'arrive pas chez tout le monde.
As the illness advances and patients grow older, there is a much greater risk of developing other health problems. Osteoporosis, for example, which results in a loss of bone density. It doesn't happen to everyone, but as people get older, the risk does increase. There is also a much higher risk of getting different types of cancer, so we test for those as well. Whether it's lymphoma, for example, or lung cancer, we see more uterine cancer in women and more anus cancer in men, often related to the human papillomavirus, which gives people genital warts. We tend to test for it more often in women, obviously. We can imagine that someone in good health, so to speak, has a life expectancy comparable to someone living with HIV. Not only are people likely to live as long as someone who is not HIV positive, they can often live an even higher quality of life, comparatively speaking. With the medical treatment available these days in terms of having to deal with side effects and adverse reactions than they could, say, 15 years ago. Obviously, as people get older, the kidneys don't function as well, nor does the liver. Somewhere around 80 to 90% of older people take some kind of medication for other health conditions like high blood pressure, heart trouble, and all sorts of other problems. So we have to pay close attention and make sure their meds don't contraindicate. And we also have to consider the patient's ability to metabolize the medication and eliminate toxins. Often we can find a treatment that will avoid conflicting with their other medication to eliminate side effects and adverse reactions. Some scientists say that the HIV-positive people they have treated for a long time could actually receive such good care and medical testing and follow-up that in the end, they are in better health than some people who may not necessarily be aware of all the health risks they have incurred.
Qui ne savent pas nécessairement tous les risques qui encourent.
I have a health affliction, but that doesn't make me sicker in the sense that I have to overreact and make a big fuss about it. You have to take the drama out of these kinds of situations. You can't take it too lightly either, but at the same time, it's quite important that you don't feel guilty or ashamed of your condition. I've never seen anyone who was ashamed of having lung cancer.
My name is Peter Barbieri. I've been positive for 22 years now. I was getting tested regularly, and I was doing the whole safe sex thing even back then, you know, so I went to get tested, so of course my parents knew that I was going to get tested that time as well. And so when I did find out that I was positive, my parents found out the same day.
I'm Fred Cruzat. I'm a doctor and I work in downtown Toronto, mainly focusing in HIV primary care.
My initial reaction was, all right, so what do we do now?
Most people that get diagnosed early on, we don't need to consider treatment immediately for many people. We often do some monitoring for some time. It can vary a lot between people, but often it's a matter of years before they need to consider treatment.
I was started on the meds right away, actually, because my T4 count was very low. I was sure I was not going to see my 28th birthday, and everybody else was as well, because, you know, my 27th birthday, everybody showed up like from out of the woodwork. And at one point, I remember at the hospital, I just looked up and I said, well, come get me now, because what's the point? You know, when just breathing is difficult. I couldn't even keep food down. I was 30 pounds lighter than I am now, which is really not big. You know, that's when I wanted to end it. But then that's actually, at that period is when the new treatments came out, the antiretroviral treatments. And then I started getting better. So who knew? You know, so here I am 22 years later to talk about it.
It takes some time to convince patients that the medications are not going to have a major negative impact on their lives. As a matter of fact, it's often a time when they might start to become healthier.
One of my proudest moments was when I was, because I used to dance for the street fairs and stuff like that on podiums, and it was when I saw my doctor down in the crowd. Sorry. And and he looked up at me and you know, he gave me one of these, and that made me very proud because, you know, he helped me get through that. And man, that was a long time ago, but I've been, you know, knock on wood, going strong ever since. And my numbers are good, and you know, I don't have any major side effects.
Many of the medications can cause nausea at the beginning when they start, often after dosing for several hours. Diarrhea would be a common side effect. Vomiting can happen, but I find that that's much less common. Skin manifestations or rashes, I think, are pretty common. There are certain medications that can affect sleep and can affect mood as well. And so these medications, I often find, are more likely to cause that again at the beginning of treatment. There are other medications that can cause jaundice in a smaller proportion of people, but that's not a concerning jaundice in the sense of having liver damage. Some of the longer-term complications could include problems with cholesterol. Lipodystrophy is related to various different medications. The side effect is really a redistribution of the fat on the body. Typically, the fat will be reduced in the face or in the arms and legs and will be deposited more centrally on the trunk or on the back. Headaches are something that are relatively common at the initiation of treatment.
There was a few drugs that just putting in my mouth gave me shivers, and for some reason I knew that my body didn't like that one. And I took it for a while, and then after a while I said to my doctor, I said, you know what, I'm not taking them now, so it's no good. I mean, you have to change it, so they did. So there are ways, you know, if some drugs you feel aren't good for you, there are other options. There's many options, you know.
And often patients who start treatment, you know, after the first few weeks or few months, once they have experience with it, tell me that the experience went much better than they expected. And I think that has a lot to do with our focus on discussing side effects, because I think it's important for them to know what the side effects are, but that in general, the vast majority of my patients eventually end up on a regimen that works really well for them and that is not causing major side effects on a long-term basis. I certainly can understand why someone would have fear in finding out about a diagnosis that has the kind of impact that HIV can have on someone's life. I think a lot of the work that we do today, though, is of a preventative nature, meaning that we try and intervene in the disease process at a time when the patient is not feeling sick. Patients often tell me, well, I'll feel it if I have HIV, or I'll know it because I'll have symptoms. And that, unfortunately, is really not true for many, many patients. You can live with HIV for many years without any symptoms at all. And the prognosis, or what happens medically speaking with a patient that can act sooner rather than later can often make it a lot easier for the patient. What we see is that patients that start treatment very, very late, when their immune system is already depleted a lot, they do have the tendency to have more other infections or to have more side effects from the medications that they do start. So early detection can help potentially protect some of their partners, but can also help them access care before they really see the potential illnesses or potential consequences of having HIV long-term.
Support is important from the people who are around you when you are diagnosed. And the only way they can do that is if they know. And bearing the weight on your own shoulders is really ridiculous. I've met a lot of people who've come up to me and secretly told me that they've that they now have HIV and actually that they were concerned about starting the treatment. What do I do? And and they actually told me that they look up to me because I'm so open with it, and it helped them get through it because they see me and they say, well, if he can do it, maybe I can too.
This is what I say to patients often with respect to how to deal with being HIV positive. I tell them that if they don't prioritize their health, then HIV will eventually prioritize itself. If you can manage and be preventative in the way that you approach this condition, then you will live a long, healthy life. But if you choose not to follow potential recommendations or to make it a priority, then eventually it can prioritize itself in your life, meaning it can cause you to be sick to the point where you can no longer ignore it. And a lot of the work that we do today is to initiate treatment prior to that happening and to really prevent that from happening and enable patients to have a full life, to work the way they want, to have relationships, to travel the world. And I don't find that medications are something that would prevent someone from doing that.
Like Mary Tyler Moore, I'm going to make it after all. I mean, it's not a death sentence.
I certainly see HIV today as much more of a chronic disease than a fatal disease.
My name is Alexander. I'm 49 years old, born in Montreal. This project, I hold dear to it because I don't think people talk enough about this topic.
My name is Doris Peltier. I was actually diagnosed with AIDS, and that's how I found out I was HIV in 2002. For me, it was a life-changing moment, really. It was shocking for my family, a shock for me, and it seemed like they pulled away too. There were many people that backed away from me, and that was really hard to deal with. They actually thought they could get it just from being around me. It was a really difficult time. I felt very alone. I was really convinced that my days were not long on this earth, but I'm still here.
When I see the obituaries of my friends who died, because I lost 53 of them in the past, to AIDS or related diseases or to poisoning by the meds of them that they took, the medications, and then I realized that all the obituaries in the newspaper said of a mysterious lung disease. Why is that a mysterious lung disease? So it kind of got me a little bit, my buttons were pressed. If breast cancer is a noble disease, apparently, so is diabetes. I don't see why AIDS and HIV should not be. We have to nobilize and mobilize. This is my new motto this year, nobilize and mobilize.
My name is Peter Barbieri. I've been positive for 22 years now. I think the biggest stigma related to HIV is that it's your fault, or that you're to blame, or that you've done something wrong, and therefore you are judged by it.
Yeah, I might be living with HIV, but it's not who I am.
For some reason, HIV has a stigma because it's sexually transmitted. But so what?
Ode boy win. Ode is the heart. Where win, when you add it to the word ode, means the sound, the expression of the heart. And that's where truth lives, in the heart. And when you find that, it's beautiful. Ode boya win, speaking from the heart. Yeah, not HIV positive. I'm positive.
My name is Rhonda, and I've been living with HIV for 8 years.
My name is Brian Conway, and I'm a specialist in infectious diseases and HIV. I've been doing this since 1990, and it's a privilege to take care of men and women who've been diagnosed with HIV and providing them with the care that they need and deserve.
I was unaware of my surroundings. It was just like I was standing in the whole world by myself. I walked out of the office and I just walked. And all I could think was HIV, HIV, HIV. What am I gonna do now? I'm dying. You feel like you're sinking. I was shocked.
Nowadays, as someone walks into the office with a diagnosis of HIV infection, one of the first things that I will say is you realize that you're never going to die of AIDS. I think you need to know that, and I'm going to say that 3 or 4 times in the next 15 minutes. But let's start by saying you're not going to die of AIDS. So now let's go over how we got from there to here and design a plan of care, a plan of intervention that's going to suit you and hopefully keep you alive for the rest of your natural life.
They started the medication, and within weeks, I was back up to almost normal again. My counts were 550, and I was undetectable. And I was like, wow, this stuff's like miracle drugs. And I just kept taking the medications every day, and everything just seemed to be going fine. And as time went on, the years went on, and I just seemed to stay healthy. I haven't been sick in I don't know how long. I haven't even caught a cold, I haven't got a flu, I haven't got anything.
Well, what people can expect to find from an HIV clinic, especially ours, is a very open, welcoming environment that looks in every way as a regular doctor's office. They'll be greeted by the receptionist, then they will have a one-on-one interview with a physician, myself or one of my colleagues, to go over their medical history to find out about their unique situation, how they came to be infected. So to have someone walk in and tell them, well, it would be better if you weren't infected, but now that you are infected in the 21st century, the treatments are simple, they're effective, and almost always I will be able to find something that's going to work for you. So let's get to it.
There's a lot worse things out there that can happen to me than HIV.